Hello, this is Dr. Karthik from Medlife. Today we will see what are the features of the Medlife automated non-invasive blood pressure monitor, BP monitor. As you can see, it's a portable device, new design. It has a large display. It actually will display systolic and diastolic blood pressure shown in millimeter of mercury. It also has got the World Health Organization WHO indicator. World Health Organization has a classification of what is considered to be normal blood pressure, borderline abnormal, and high abnormal blood pressure. So it has an indicator for that. It has a green and a red indicator which is shown on the display on the left hand side here. It also detects abnormal heartbeat. There are some patients who have skipped beats. They have either irregular rhythm or they have an abnormal rhythm of the heart where the heart does not beat in the normal rhythm. So it detects irregular or abnormal heartbeats as well, and it shows up on the monitor if it is there. It has got dual memory function, inbuilt memory of 99 recording, and an SD card, memory card that can be put, which will also store an additional 99 recordings. It has a date and time function, as you can see, and it has a large display, which is good. And it also has, in addition to the battery operated feature where you can have inbuilt battery, so you also have the USB charging port, which is available as a feature here. So this is one of the widespread, more popular model available in the market today. So we recommend that patients who have a high risk of blood pressure, developing high or low blood pressure, and patients who are currently on medication or you're taking medicines to manage your blood pressure, they should monitor their blood pressure at home, once in the sitting position, once in the lying down position, preferably connected to the left arm. And that is a very important part of blood pressure management. We will now see the features of the Medlife non-invasive blood pressure monitor. As you can see, the monitor has got a large display. It shows the systolic blood pressure, it shows the diastolic blood pressure measured in millimeter of mercury. It also has an indicator here. You can see here there is a green indicator and there is a red indicator. This basically refers to the WHO classification, World Health Organization classification of normal versus abnormal blood pressure. You can see there are a few indicator sticks that are going up. As long as the sticks are within the green indicator, it basically shows that the blood pressure recording is within the normal limits. And once the indicator sticks are actually moving towards the red, it shows that the blood pressure recording could be abnormal. So whenever you find that if the blood pressure recording is coming here to be extremely high, you always need to look for two things. One, please repeat the blood pressure once in the lying down position and once in the sitting position to ensure that the measurements are coming as consistent, and you need to seek medical attention if the blood pressure is in the abnormal limit. It also shows the pulse rate here. This machine has an internal memory of storing 99 records. It also has an SD card where it can store 99 records on the SD card. So put together 99 into 2, it can store about 198 recordings in this. It has an inbuilt battery and it also has a USB port for charging. So both types of USB charging option and battery options are actually available. So this is a very modern style, modern design blood pressure monitor, and this is something that needs to be used for all people who are at risk of developing high blood pressure. And this actually helps in home monitoring of blood pressure, which is very important to see what is the day versus afternoon versus night variation in the blood pressure. So a very portable machine, and I would recommend that patients who are having a risk of blood pressure or patients who are currently getting treated for blood pressure, you're taking blood pressure medicines, you need to monitor your blood pressure regularly as your doctor would have advised. We will now see how to record the blood pressure using the Medlife BP monitor. It is very important to understand the right procedure of applying the BP cuff, which is what you're seeing here. It is important to know what are the connections that you need to check before you take the right measurement. Okay, so all of us can see that this is the cuff. There is one pointer that is given here. I'll explain why that is important. There is also, once you open this, you can see there is a hose or a tube, and there are two lines given here. I'll tell you what is the importance of that also. So the first thing we have to see is that when you are measuring the blood pressure of any patient, First, it is always advisable that we measure the blood pressure of the left hand of the patient, which is directly the blood that is flowing from the left side of the heart, okay, which gives the more accurate blood pressure, preferably. Second thing you need to notice, it is always preferable to apply the cuff directly on the skin of the arm. It is not advisable to apply it on a thick jacket or on a thick shirt. The reason is you will get inaccurate readings. Always advisable to expose the skin of the arm and then apply the cuff. So I will now show you how to apply the cuff. So you can open the Velcro like this, and then the arm should be rested on a table, preferably like this. BP can be taken either with the patient sitting on the chair like this or with the patient lying down on the bed. And they're also preferable to take BP from the left arm in comparison with the other arm. So you will insert the cuff like this, and when you are inserting the cuff, it is very important to see that this small, band that you are seeing here, this band should be maintained at the middle of the arm like this. That is the right placement of the cuff. And once you have seen the band is in the middle, then you pull the Velcro like this and you apply the Velcro over here. So this is a right application of the cuff. Very important to remember that you should use the right size of the cuff for you to get the right measurement. If the patient has got a very thin arm and you're using a large cuff, you can get an abnormally high BP recording, even though the patient may not have high BP. If the patient's arm is very large in size, very thick, and you're using a small size cuff, you may get an abnormally low recording, even though the patient may have high BP. So it will lead to erroneous or error in recording. So always choose the right size of the cuff. This is the right size where you can see that this is middle engaged, and when you pull the Velcro, it is also coming to the center. So you will know if the cuff is small or large in size. Better to choose the right cuff. Most BP monitor manufacturers do have options of giving you small size and large size cuff if required. This is the Medlife BP monitor. As you can see, this it has a large display. This is the systolic and diastolic blood pressure, and it also gives the pulse rate here. So what we need to do is make sure that the hose is connected well. This should not be disconnected or it should not be loose. How do you know that it is connected well? So once you basically connect it fully, you can see that there is an arrow mark that is given here, which is inside, and that arrow mark will be completely, inside, showing you that it is a right fit. After which, to record, I will keep this on the table. It should always be rested on the table. You press this is the power on and power off button. As you can see, we press the power on button, and then the machine will take a little while and it will start the measurement. So with the measurement, it is now pumping the air into the cuff, and the cuff is actually inflating, and it will inflate for some time and then start deflating continuously. You can now see that the cuff is deflating, and each beep is actually the pulse rate, that beep that you are seeing. And after some time, you will see the blood pressure recording, systolic and diastolic will be seen. You can see here the measurement is complete. The systolic pressure in millimeter per mercury, diastolic pressure in millimeter per mercury, and the total pulse rate is seen. So for this particular person, so all of them are in the normal level, so you're doing good, not to worry. Okay, so therefore you can see that all the measurements have been taken properly. This is the right way of actually measuring a non-invasive blood pressure.
Hope you like this video. Subscribe to our YouTube channel and look forward to more such videos.
Medlife.